Kenyatta University Teaching Research and Referral Hospital KUTRRH, in partnership with Operation Smile Kenya, has begun conducting surgeries to rectify cleft lip and palate deformities. The hospital acting CEO, Dr. Zeinab Gura, says that screening is being conducted to establish patients who will require surgeries, adding that the partnership is intended to deliver the critical interventions to victims. Some 70 patients are set to benefit from the week-long free surgical camp at the facility.
So this week, starting today, we are screening up to over 70 patients so that we are able to identify the ones who need surgery and take care of them over the next 10 days. Also, as a hospital, we are going into more formal collaboration with Operation Smile Kenya so that we can provide this surgery on when and as needed as by Kenyans who come to our hospital. And part of this initiative is also to build capacity so that we have capacities in this hospital that can on a regular basis provide this service to Kenyans. This is part of making sure that we are able to provide back to the communities in collaboration and sponsorship by Operation Smile Kenya, who are working with our hospital to deliver these critical interventions for these segments of our population who undergo various challenges if and when these defects are not corrected. The cleft lip and palate are actually congenital defects. They are things that people are born with. So this week, starting today, we are screening up to over 70 patients so that we are able to identify the ones who need surgery and take care of them over the next 10 days. Also, as a hospital, we are going into more formal collaboration with Operation Smile Kenya so that we can provide this surgery on when and as needed as by Kenyans who come to our hospital. And part of this initiative is also to build capacity so that we have capacities in this hospital that can on a regular basis provide this service to Kenyans.
Operation Smile Kenya Country Manager Dr. Asaph Kinyanjui reiterated by saying that the surgeries and medical interventions will restore smiles and enable the patients to live comfortably. Dr. Gura and Dr. Kinyanjui rallied Kenyans to register under the Social Health Authority, saying that treating the deformity, which costs about 90,000 Kenya shillings, was costly especially to Kenyans at the bottom of the pyramid.
You know, in Kenya we have about 2,000 babies born with cleft lip and palate annually. The biggest challenge with this condition is that these children are not able to feed as expected. They are not able to sometimes even get the required milestones. And even when they get into school and into teenagehood, they face a lot of stigma and discrimination from their peers. So this week we are here just to be able to correct those surgeries so that these children are able to live as comfortable as possible. And as the CEO has mentioned, we're also looking at long-term partnership with the hospital so that we can be able to, on a daily basis, be able to offer these surgeries without having to organize for a surgical program. Bigger to that, we're also looking at a partnership with the hospital so that we can also engage and be able to train even people or healthcare providers in the county and the sub-county region so that also these students don't have to travel for 500, 600 kilometers to come to Nairobi for care. And beyond that, as Operation Smile, we're also looking at partnering with the Ministry of Health so that we can also be able to develop policies and guidelines that look at safe access to safe surgeries so that even as a country we are able to promote quality of care and also be able to cascade services at the regional and county level. And the goal is also to ensure that as universal health coverage, which is in line with the Ministry of Health and the county and the government policies, so that also patients don't have to travel for long, they don't have to spend so much money and resources as they seek for care. So for this program, what we're also doing is supporting patients in terms of their logistics. We're also supporting patients in terms of their direct hospital cost. So the surgeries are for free, but Operation Smile is going to cater for those costs. And we thank the hospital for the great support they have given us to ensure that we're able to have a successful program.